Hello, my name is Kurt. I'm a registered nurse and a graduate of ACC, and I'm here to talk to you today a little bit about what primary care is and why it's important that you have a primary care provider. So let's jump right in. First off, what is primary care exactly? Primary care can be a lot of things. According to the American Academy of Primary Physicians, primary care includes health promotion, disease prevention, health maintenance, counseling, patient education, diagnosis and treatment of acute and chronic illnesses in a variety of healthcare settings. That is a lot of different stuff, and that's one of the reasons that primary care providers have also been referred to as general practitioners, because their scope of practice is so broad. Essentially, primary care can be kind of a continuation of the routine pediatric care that you may have received while growing up. Primary care providers provide a way for you to establish a relationship with your healthcare provider. They can provide access to resources and referrals to specialists when you need them. They can provide you with preventative care and screening, and they can help you live a healthy, balanced life. Primary care providers can be doctors, physicians, assistants, or even nurse practitioners. So why should you have a primary care provider? Well, the first reason is that primary care providers can get to know you best, which can lead to better health outcomes and more comfort navigating the healthcare system. Primary care providers are long-term partners in your holistic, comprehensive care. It's important to take the time to find one that you can really trust and will meet your individual needs. Having a care provider that you see regularly helps you establish a relationship with a physician. Having a therapeutic relationship with someone that you trust will make it easier for you to talk about health issues that you may be having that would be harder to talk about with someone you're meeting for the first time. And the long-term nature of primary care allows your provider to see trends in your health and see when there might be something that needs attention before it becomes a bigger problem. Because of the interpersonal nature of primary care, treatments are highly individualized to your personal health goals and needs. No two people are exactly alike, and having a physician that understands you and your unique individual needs is invaluable for your long-term comprehensive health. Primary care can cover concerns from mental health to chronic health conditions to your own personal development. Primary care physicians provide a huge range of services, and even if you're perfectly healthy, you can benefit from primary care. Primary care providers provide support, treatment, or referral for practically any health condition you may experience, even mental health. An estimated 1/3 of the population will experience some sort of mental health disorder within a 12-month period, and most people get their treatment through primary care. Primary care physicians are in a unique position to help treat people holistically instead of focusing on a health issue that's only within their specialty, because holistic care is primary care specialty. No health issue is too small for primary care. If it's not an emergency medical issue, primary care should be your first stop for treatment, prevention, or referral. Another reason that primary care is important is that it can help connect you to community resources and referrals to specialists that you may need. Sometimes it can be hard to know when it's time to seek out a specialist. Primary care physicians can work with you to determine what needs you have that may be out of their scope of practice and can send you in the right direction to help deal with your unique health issues. Because of the trusting relationship that you can develop with a primary care provider, you can trust that their referrals will be the right match for you and that the people they send you to will meet your needs. Depending on your insurance coverage, you may even need a referral before you can see a specialist and have it covered. Primary care can be a center for all of your preventative and health screening needs. Primary care has the potential to save you a lot of time and money, as emergency treatment can be extremely expensive. Preventing minor health issues from becoming emergencies is critical to living a long and happy life. Primary care can help you stay up to date with all the preventative and screening needs that you may have. From vaccines to colonoscopies, it's hard for a person to keep track of all the screenings they need and the times that they should have them. Primary care can serve as a health center for all of these needs. Research shows that those with a primary care provider are up to 20% less likely to die from a preventable illness. And research also shows that those with a primary care provider spend significantly less on health care than anyone who just sees specialists alone. In summary, primary care is comprehensive care for all of your health needs. Primary care allows you to establish a relationship with a provider who can work with you to achieve optimal health. Primary care covers you for nearly any health issue that you may have, from chronic illness to mental health. Primary care has the ability to connect you to the appropriate resources that you need, including specialists and community referrals. Primary care is important for preventing illness and helping you live a longer and healthier life and saving money. Everyone deserves a good primary care provider, and I hope you're able to find one that works for you.
Health insurance. Everybody needs it. Should you have it? Yes. So let's just talk about health insurance for a little bit. Young adults can stay on their parents' insurance until the age of 26. You can also look, they sometimes have student health plans if you're in college, like you are now. There are individual deductibles and family deductibles, and usually the individual deductibles are going to be less than the family deductibles because there's less people. If you have lower income, there's Medicaid. Veterans have VA benefits. And if you have a family, if you're married, don't have kids, it's sometimes better to just do individual plans. So there's different types of private insurance. There's HMOs, PPOs, and EPOs. HMOs are very restrictive, and they have a PCP that is in-network. You need a referral to go see specialists, and they do not cover any out-of-network healthcare costs. And HMO stands for Health Maintenance Organization. PPOs, Preferred Provider Organizations, are the least restrictive, and they usually offer in-network for a lower cost, and you can choose it out-of-network for a higher cost. They usually have an expensive premium, and you still need a referral to see specialists. EPO, Exclusive Provider Organizations, are a mix between HMO and PPO plans. You don't need a referral for specialists, and there's no out-of-network. It doesn't cover out-of-network physicians. And it's usually more expensive than the HMOs, but less expensive than the PPOs. Other key features, some terms that I want to define. A premium is like your monthly bill. Every month you want to pay a premium to the health insurance company so that you have it. But it doesn't go to any of your services that you use, like dental visit, vision. If it's a lower premium, you're going to have to pay more out of pocket for those risks that you take if you get into a car accident or break your leg. A deductible is how much money out of pocket you're going to pay before the insurance kicks in, before the insurance pays for you. So usually a deductible can be anywhere from $1,000 to $5,000. Usually the lower the premium, the higher the deductible. It's a risk that you're playing. Copay is a fixed amount that you're going to be paying for a specific service or prescription medication. And usually you pay that before you hit your deductible, like going to the doctor's office for a checkup. Other important facts, there is a period called open enrollment period, and this is the period that is designated from your work, usually in November, December time, when you can join or switch plans. There is also a special enrollment period that begins with a qualifying event. And the qualifying events literally qualify you for a special enrollment period. So some of those include getting married, having a baby, moving to a new zip code, or turning 26.